Good evening. This is Derek Maxim, Chairman of the Lakeville Board of Health. I'm calling the Lakeville Board of Health meeting to order. It is Wednesday, January 20th, 2021 at 6 p.m. Is there anyone recording this other than LakeCAM? I hear no one for the record. In accordance with Governor's order suspending certain provisions of open meeting law relating to the 2020 novel coronavirus outbreak emergency, the January 20th, 2021 meeting at 6 p.m. of the Board of Health shall be physically closed to the public to avoid group congregation. However, to view this meeting in progress, please go to www.facebook.com/LakeCAM. You do not need a Facebook account to view this meeting. This meeting will be recorded and available to be viewed at a later date at http://www.lakecam.tv/. Permit me to confirm that all members, staff, and persons anticipated on the agenda are present and can hear me. Bob Palucci,
Present.
Chris Spratt,
Present.
Ed Cullen, our health agent,
Present.
and I believe we only have one engineer for all of the things on for tonight. That should be Zenith Consulting Engineers. Niles, can you hear me?
Yes, sir.
Okay. Do we have any homeowners on that you're aware of, or abutters, or anyone that you're aware of?
Not that I'm aware of.
Okay, thank you. First on the agenda was 9 School Street. It was continued from January 6th, 2021 meeting with SFG Associates to discuss revised local upgrade request. They're requesting a variance to the water table from 4 to 3 at the previous meeting. And we were not in favor of it, so he was going to redesign and move the system, which he did do, and he took away the reduction to the water table, so it did not need to come to the meeting. There was only one waiver on it, I believe, for a sieve analysis, and Ed was able to sign that one. So that one is off the agenda and approved, I believe. Next on the agenda, 8 Marigold Lane, meet with Zenith Consulting Engineers to discuss local upgrade approvals. Niles, I believe we had a request to continue that. Is that correct?
That is correct. We're actually in the midst of, we just, I went out there with Ed last week, I believe, and we did we attempted to do a perk test, but we ended up having to do a sieve analysis. I actually just got my sieve results back today, and we're currently working on a redesign for the new system. So that'll be coming in front of the board shortly, as we will be within 400 feet of Long Pond with that.
Okay, so you'd like to just continue to the February 3rd meeting?
Yes, sir.
All right,
I'll make a motion. We continue to February 3rd.
Second.
any discussion? All those in favor, Bob Palucci,
Aye.
Chris Spratt,
Aye.
Derek Maxim, aye. Thank you for that one. Next on the agenda, 41 Clark Road. Meet with Zenith Consulting Engineers to discuss requested local upgrade approvals. Again, Niles, I'll turn it over to you for an update on that property.
Absolutely. So this is 41 Clark Road, as you stated. It's an existing 2-bedroom dwelling. Went out there, we were able to get a perk test. We got a perk rate 10 minutes an inch. Ed and I were out there right before Christmas and did that. We didn't find any water table, which is pretty consistent in that area. As you can see, it's a very small lot. It's about 5,500 square feet or so. Luckily, we are able to get over 100 feet from all wells, including, all abutting wells. Our property is actually serviced by the water service inside the Clark Shores Association currently. So the only 2 local upgrades that we are asking for are, we are asking for a reduction from 10 feet to 5 feet to the property line of Thompson. We did notify them and of the meeting, and I believe we gave proof of that, proof of that to your board when we filed. And we are asking for a reduction in the number of deep holes from 2 to 1, just because of the limit area on the property. And that's really about it. I think overall, this reduction to the property line is really not a health issue, in my opinion. Especially where we can get to 100 feet from all the wells, that allows us to do that. So I think it's a benefit to grant this. I'd be happy to answer any questions.
Okay, thank you, Niles. Yeah, I went out and looked at it today. Like you said, it is a very tight lot. I see you're using a plastic tank. Is that just because there's no way to get the crane truck in the back to set a tank?
That's correct. Yeah, that was a request by the contractor that's potentially installing this. It would be much easier to do that than to try to get a truck, to try to get an actual concrete tank back there.
Okay. And I don't see any grading issue where it's going back to the original contours and the water's just going to keep going always in the same direction it always has been.
That's correct. Yeah, the only thing that has to be done is the shed that's there has to be relocated, which is obviously not really an issue, but it's just going to be done. It's on just on concrete blocks currently, so that has to be moved. But besides that, it's pretty straightforward.
Okay. I have no other questions. Just the water line, has that been replaced with a new year round down that far on Clark Road, or is that still on the old shut off service in the winter? Do you know that? Or Ed,
I believe it's on the old shut off, but I'm not, Ed might know better than I.
I think you're right, Niles. They haven't come down there. They did go pretty close to there, but I don't think they've come down that road.
I agree.
Okay. I see there is a 2-bedroom deed restriction, and obviously it'll still be seasonal, even though there isn't a seasonal deed restriction on this property that I'm aware of, but obviously seeing the water shut off, it's obviously a seasonal property until that comes down to the road. Other than that, I have no other comments on this one. Bob Plucci?
Yeah, no, I'd rather have it away from a well than, going near the property line. If it was gonna be raised 4 feet out of the ground, maybe I'd feel different, but it's in the ground. It's really the best place to put it. So I don't have any problem with it.
Chris Spratt?
Yeah, Niles, the Thompson butter, like, are they tied into the year-round water already?
I believe so.
Okay,
There's no well. There's definitely no well on their property. They were, I believe, already tied in.
right. Does this like a rehab and flip probably, I'm guessing?
Yes, it is.
Do they have plans to tie into the water service already when it comes down?
I can't answer that question. I'm sure that they will. I mean, only benefits them in the long run, but I can't answer that question right now, unfortunately. I know if it were me, I would.
Right.
And
Yeah,
again,
other than
Chris,
that, I think everything else I was thinking about has been answered already, so.
okay. And Chris, on that comment, they don't have a well on this property, so it's the only water they have is to be
Yeah.
tied in. They don't have another option,
Oh, yeah, I'm just,
but to be tied in.
it was just,
Okay,
I was thinking about it because of I don't know. I just think about people living there year round, that's all.
right,
The sooner we can get tied into year round water, the less we got to worry about that stuff.
correct. Especially where they're trying to sell it. Hopefully it's told to the buyer that, well, obviously if it's shut off right now, they don't have water, so.
Well, I hope the buyer knows better. Do you know who it was, Derek?
Right. Yeah, hopefully they're well aware. All right, I have no other comments on this one. Ed, any comments on this one?
No, I think you guys covered them. I agree with Bob and you with that. It's better closer to the property line than the well.
Okay, thank you. Anyone on Facebook would like to comment or any other comments before we take a vote on this one?
No comment from Facebook.
Chris, do you have the plan in front of you?
I do. I'll make a motion to approve the subsurface sewage disposal system upgrade at 41 Clark Road, Lakeville, with 2 local upgrade approvals.
I'll second that.
Any discussion? All in favor, Bob Plucci,
Aye.
Chris Spratt,
Aye.
Derek Maxim, aye. Thank you, Niles.
You,
Next on the agenda, 6 Margot Drive, meet with Zenith Consulting Engineers to discuss requested local upgrade approvals. Again, Niles,
Yes.
I'll turn it over to you.
again, for the record, now Zager from Zenith. So this one, we have obviously a much larger lot, but amazingly a lot of restrictions here. Existing 4-bedroom home. Septic system is located in the rear, currently in the water table, completely in failure. Water table was coming in right around 40 inches, so about 3.5 feet or so down. So what we're doing, what we have is we have a few different resource areas that we have to deal with here as far as conservation. And we actually have a plan in front of conservation where we're going to be, I believe we're in front of them in the next week or so. But we have 100-foot buffer zone to the bordering vegetated wetland. We also have a 200-foot outer riparian zone from, there's actually a stream that we have to stay outside of if possible. And then the light blue line is a flood zone, zone A, zone X. So basically in that backyard, we got 3 different resources that we are contending with, along with an in-ground swimming pool, a shed, ledge outcrop, and some grade issues. So what we're looking to do is we're using a Presby system. We're using a Presby system to allow, per their approval, a reduction from 4 feet to 2 feet. Again, we still need a pump system because of the depth of the plumbing coming out of the building, and we cannot raise that. But this allows it to not, be graded up in a manner that would make the yard unusable, especially with the pool and the resource area. The major issue here is with the flood zone. We cannot fill in that without having to compensate for that filling somewhere else on the property. So we're trying to keep the grade as close to natural as possible, which with this we're essentially doing. So we were asking for a reduction from 4 feet to 2 feet allowed by the Presby approval. And then we're also asking for a request to use a sieve analysis instead of a perk test because it was obviously just too wet at the time of construction. I'm sorry, just at the time of the perk test. And we're also asking for a reduction for the 2 holes to 1 hole, I believe. Yes, the 2 holes to 1 hole, just like on the last one. So be happy to answer any questions that the board has.
Okay, thank you, Niles.
Thank you.
Yeah, unfortunately, I still have questions on this one. I think you've known on a bunch of them that have been coming in front of us. We're kind of leaning against keep granting these variances to the water table. A couple of reasons why I'm against it. One is all the resource area around it. So it's just more of the reason to keep it up. But also, when you remove, your perk rate was done on a sieve in a class 2 soil, and your loading rate was 0.33, which is about 30 minutes an inch soil. But yet you're removing that soil with a remove and replace down 6 inches into the water table to 93.7, which you call water at 94.2, I believe. So you're removing that down, taking out that 30 minutes an inch soil, replacing it with a Title V soil, which is less than 2 minutes per inch. And honestly, on most Title V soils I've seen brought in, you can't even pre-soak in that material. You can dump 24 gallons of water in under 10 minutes, and you can't even keep it at that 12-inch level to pre-soak. So it's really draining it probably less than 1 inch a minute. And I just feel that their intended purpose when you grant this variances, it should be put on that 30 minutes an inch material. It shouldn't be put on a remove and replace where it's going to drain through that 2 feet of material in 24 inches or less. When it was anticipated, it should have taken 12 hours. of treatment to get through this. I've already had some conversations with some engineers and they don't really agree with me on this one. Because it doesn't say it in Presby. It doesn't say if you have a remove and replace, you can't ask for this. I did look in that today to see if I could find it, and Ed looked in it, and we couldn't find that. And it doesn't say it in Title V when you do a remove and replace. You got to design 5-foot separation instead of 4. It's not in there. So I understand the argument, but I just think when you go into 2 feet to water table, you're just really getting close. And this water, we've had a lot of discussion lately with professionals on this topic where the treatment is done in the vertical separation. Besides nitrates. Nitrates don't disperse until they actually hit the water table. So once this water would hit the water table, you don't get any more treatment. It happens in that 2 feet. So that's just my feeling on getting it. I understand you don't want to have to fill because of the flood plain, but I think you're doing more harm by trying to put this down to that water table. And I know if you went to that 2 minutes less, because that's what you're actually filling it to into the water table, Presby allows you to go to 5 to 3, which basically you're doing it 4 to 3. You're just not, you're asking for it in a different way. So you're already at 3, in my opinion. I know it makes the system a foot higher, but you already have a pump system. So it's not like we're trying to, eliminate a pump where you can't change the plumbing and you're only missing by a couple tenths. We're already pumping. That was just my thought on this variance. We're trying to go to 2 feet. And then also, I just have a question, Niles, on the water table that you called. The perk elevation was off to the side down the embankment at 97.5. You had models at 40 inches and actual water coming in the hole at 46 inches, but you have a 99 contour directly through the center of this field. And in all of my case from experience, when you have the water running through that B layer, it follows the contour of the ground. So if the elevation is higher, I'm going to presume it's at 40 inches. So if you go 40 inches from that 99 grade, you're at 95.7. You're calling water table at 94.2. And then asking a variance to that. So I just think without actually determining the water table at that 99 grade, maybe at the time of installation, it would be hard to definitively say that that water table is at 94.2, seeing you did the perk down the embankment. Do you not agree with that assumption, or?
Well, no, it's not that I don't agree with it, but I think, and again, I was out there at the beginning of the perk, but I actually have one on my, so I wasn't there for the entire thing. So I didn't dig another hole out there, but I believe that the majority of that is fill. And I think it's filled up as you go up there. So I do agree with the sloping. But I think what you're going to find is that there's more fill on that side, and you might find that it is lower. But as far as would the board be more comfortable if we only asked from 5 to 3? Gave a 3-foot separation. Is that what you're saying? So I have to raise this up a foot. Would that be, you'd be more comfortable with that? Or are you saying you want it to be the full 4 feet? I guess I just want to get clarification because I'm a little confused on what the board would like.
Okay, and again, I'm just speaking for myself as one member. The other 2 members might have a totally different view.
Understood.
But I think we're getting to the same point either way by just Presby, like you said, it doesn't say in a remove and replace, and they give you that foot from 4 to 3. And so by going by their approval by DEP, just they don't say when you put the sand under it, you have to go to 5. So I don't see I have the right to make you go to 5. I'm just saying I think I'm comfortable going to 3 where DEP already allows you. You don't need this board's approval through using that Presby, which kind of is the same in my mind, 5 to 3 without it. I just think that 2 feet is pushing it close. I don't like going that close. and improving it. I just think the higher above the water table, the longer the system's gonna work for these people. I went by there today. The house, I'm not sure the age of the house, but it's definitely not that old of a house. And the system's already in failure.
I think it was built in the 90s.
Okay. And then the other thing with the water table, I totally agree with you on that, Niles. If the original topo, which I don't know what the topo of that lot was before this lot was built, it could have been flat at that 97.5 grade. And if it was, then the water table is probably could be down at that grade. But again, without knowing that, and actually, I just think I would feel comfortable at the time of installation, making sure that Ed was there as a soil evaluator to witness the water table, maybe along with yourself, just to determine. I don't want to have it 3 feet to water and blow the water table by 1.5 feet.
Right.
Again, I know it's going to raise the system more and it's going to make complications for you. I don't really know what other option we could have. Again, could you move the system a little further to the left property line and take down that tree where your benchmark is to make the grading work a little better? If you don't think the water table is going to follow that 40-inch contour?
Potentially. You know, I have no problem raising it up a foot. I'll look at that and see what I can do there. And then I guess if we can just make it a condition of the approval that Ed and I go out there to confirm, because I like to see the bottom hole of every system anyway that I do, to go out there and confirm it. And if there's an issue, then we'll deal with it on the site. I'd be amenable to that.
Okay, yes, and I know on your plans, you're one of the few engineers that actually have it on your plan that you want to witness the open hole. It's actually on your plans. I don't know how many people actually call you to do it, but it's on there.
That's correct.
Again, that was all my comments on this. I don't see any other real options, like you said, with all the marking of the wetland and everything in that river. So I'll turn it over to Bob Palucci. Do you have for comments on this one?
Yeah, no, I kind of, you know, I feel the same, you know, another foot, hopefully you can pick some of it up in the grading if that's where we end up in, but I mean, that's the oldest question that I've asked people. I've asked them at conferences. I say, well, if you're doing a remove and replace and you're going to fill it all with perk sand, then why are we still designing for you know, the junk soil that was in there in the first place? Why aren't we designing for the 2-minute an inch stuff? And I've never got an answer that I understand, even though, you know, I'm not an engineer and they say there are reasons for doing that, but yeah, I think, you know, I think the other foot would, you know, do a lot and hopefully can pick up some of it in that hill, pushing it over. I mean, I'd rather, you know, get it closer to the property line and so we can work with the grade than go the extra foot, you know, unless there was no other option.
Okay, thank you, Bob. Chris Pratt, comments?
Yeah, the Presby stuff, I never really did a lot of them before I was on the board. So all this stuff is interesting to talk through it all and the different, it is interesting. The, you know, the idea of replacing garbage with perk sand and designing based on the garbage. It is interesting. But I was looking at, as you were talking, Derek, I was looking at the same thing as if we could shift it up, you know, the grades going up over, you know, to the north of where you got it designed, and you could catch some there where it's already pumped. It's not going to make that much more of a difference. It's just probably a matter of how much trees there and is it woods. And I know this neighborhood because I live across the street from that street. So I know there's a lot of ledge over there. So that's probably one worry maybe. And what's hiding in that higher stuff. But yeah, I tend to agree to try and keep it out and, you know, to keep it higher. granted to get the extra treatment, but then, the further we can, getting when those nitrates hit the water, if we can get them a little bit further and get them to kind of spread out a little bit more before they go into the main water, it's usually a good thing. I'm just thinking about that because of my other job, where we try to keep nitrates out of the wetlands and stuff because invasives grow and all that other stuff. But yeah, I wouldn't mind seeing it moved a little bit.
Okay, thank you for that. Yeah, and again, on the Presby too, just, I mean, I know it's approved as a treatment system by DEP and it was tested and certified. But again, I don't really know how much real treatment you're getting out of a Presby with some corrugated ADS pipe and some 12-pound fishing line wrapped around it with a piece of filter fabric. Again, it must work to a certain degree because it was passed and approved by DEP. But it's definitely not the top of the line treatment system when you're trying to go to 2 feet. But with that said, I'll just ask Ed, comments or anything on this you've come across you want to discuss?
I think you guys covered it, both what you said about the 99-foot contour there, that the groundwater probably is higher there. I actually think this part up here, this is a more natural part, and the fill was put down here closer to the wetland because the slope of the yard, they wanted to flatten it to make it a little more useful. So we had about 18 inches of fill down here. Now, we didn't do a test pit up here, but if you do look on the on this, there is a clear slope. These are 10-foot contours, and the natural slope does go up there. So I do believe the groundwater is higher on that side. And like I said, so I think 2 things. One, that the groundwater should be adjusted for the 99-foot contour and for 40 inches there. And then as well, what you're saying about the 2-foot reduction, rather than going, getting that 1 less foot, going 4 to 3 rather than 4 to 2. And there are a lot of options here too. I mean, if you're worried about grading down here so close to the buffer, you can you make it longer, remove the shed, or relocate the shed, or what Bob said, and just push it up a little closer to here where this tree is. Because like I said, there's a 101 contour right here, and the top of your field's 98.5, and you got 101 here. So that's 2.5 feet higher is the natural grade compared to your top of your system. So there's definitely room for both raising it and relocating it. That's all.
Okay, thank you, Ed. So I guess, Niles, I'll put it back to you for a minute, just to think which way you'd like to go. Is this something that you would agree upon? And just, again, I don't think we should just call the water at 40 inches at 99, unless I think you'd really want to probably dig a hole to see if there was fill there and keep it as high as you can. How do you want to go with determine the water table where you move it to? I mean, obviously we're going to have to if you do shift it higher up to that 100 contour, even the other side of the stump you have the benchmark set on, we're going to need to determine the water table at that point. How would you like to go about that one?
It's a good question. I mean, I'm amenable to the 3 foot. That's for sure. I can talk to my client about that, but the sliding it up the slope may hurt us. I don't know. It was just a thought. I mean, I can't disagree with Ed, but I don't know if I necessarily agree either. So I'm gonna have to get back to my client and find out how they want to handle it. I don't want to answer the question and just, stick my foot in my mouth. So I'm probably going to have to ask for a continuance.
Okay, I'm all right with that.
Chris, you all right with
I'm
that?
good with that too.
We can continue to the February 3rd, and maybe you can see what you want to do to relocate a little. As long as they're not in a hurry, or if it's in total failure, or it's 2 weeks.
All right, I'll make a motion to continue to February 3rd.
Second.
Any discussion? All those in favor, Bob Palucci,
Aye.
Chris Pratt,
Aye.
Derek Maxim, aye. All right, thank you, Niles, on that one. Now we have another one on the agenda. 41 Fuller Shores, meet with senior consulting engineers to discuss requested local upgrade of approvals. I'm going to turn it over to Niles again on this one. And on this one, I am going to recuse myself from this point on this property. So Chris, maybe you can take it from there and do the vote, and then after that, we'll be under old business. Niles, thank you.
Again, for the record, Niles Zager from Zenith. So this is a existing 3-bedroom system. It was in failure, pretty significant failure. And we went out there, and I went out there and confirmed the soils that were done. So I believe Darren Michaelis had gone out there in 2013, and I went out there back in the middle of December and to confirm the soils, and found, if not better soils than he found, because he found like a loamy sand and then a medium sands. I found like a medium to coarse sand and gravel down below. So the soils itself were, I didn't see an issue at all with. And he got a 2-minute perk rate. We designed it a little bit over that. We designed it over just to be safe. But yeah, we're basically taking what's there now and replacing it with a new compliance system, basically 40 infiltrated quick 4 chambers. And we're meeting all the setbacks as far as property lines, wells. There was no really local upgrades requested other than the fact that we're not within we're within 400 feet of Long Pond. We were actually, these variances are, these local upgrades were granted on the previous design, and we're just kind of, I guess, renewing them. So that's really about it. So we're 350 feet plus or minus from Long Pond with the leaching field, and about 340 feet from the existing tank. So be happy to answer any questions.
Yeah, I think I'm all set with this. Oh, am I muted? No. Yeah, there's not much really to comment here. How about you, Bob?
No, it's the same thing. I mean, I know of it, and you look at all the circles, you look where it is in the lot, you can't get any farther away. That's why it went there in the first place. So I don't have a problem either with it.
All right, Ed, do you have any comment?
No, I think it's the best place for it too. Like I said, it's, you try to keep away from the wells and the pond, and you get good separation to the groundwater. So, I think it's fine there.
All right. So now, do you have the paperwork, Bob? Make a motion.
Yeah, I'll make a motion that we approve the 2 waivers for the reduction for the setback of the septic tank, 340 plus minus, in the pump chamber, 350 plus or minus to a surface water supply, 400 feet minimum, at 41 Fuller Shores Road, knowing that the field is in the same location. Does that have a pump chamber?
No, it does not.
No, I'm reading this, yeah.
Yeah, it's a typo of mine.
Okay, so is it only one waiver then, just for the one tank?
No, one's for the tank, one's for the field.
Oh, okay. And I'll amend that to the 2 waivers, one's for the tank and one's for the field.
I'll second that. Any discussion? All those in favor, Bob Palucci,
Aye.
Chris Spratt, aye, and Derek is abstaining.
Thank you.
Thanks.
Thank you, Niles.
Thanks, Niles.
Have a good night.
Good night. See you in a
Thanks,
week.
Niles.
Next on the agenda, just an update on the 43D committee. I'm not sure if we had another meeting since I was on the one. I'll turn it over to Chris for any updates or discussion on it.
No, there's nothing new. I think since that last meeting where we were all on it. The one thing would be, Ed, did they bring in any revised plans yet?
No, they did not. We did do soil testing out there. They were considering lowering the field. So we went down about 18 feet just to make sure that the, it was the same material. It was. We did encounter a small, I guess it was a pit that they threw some old foundation and some trash in within the field itself. So we'll, when we do the open hole, we'll have to make sure that that gets removed.
The other thing would be, so you sent a letter for some of the questions that Derek had, right? Are they going to address those with these revisions?
They should. I mean, I actually discussed it with them while we were doing the soil testing, and they said they would consider it, and then but there was no definite okay, yes, they're going to do this or that. They said they would consider it and look into it.
Okay. Yeah, I didn't have anything new besides just to make sure to see if we had revisions yet. Do you guys have any comments?
There's another meeting tomorrow, right? But that's only for traffic, I understand.
I believe so.
Okay.
Yeah, and I have no other comment on that one. I know you weren't on the meeting we were on, Bob. We continued our Board of Health meeting to February 18th, I believe. Was that the date, Chris, that we got continued to? As for the Board of Health, where we need to be on and
I
at the
believe
meeting.
so.
Yep, that's fine.
And the rest you can
17th.
obviously,
Oh, wait, 17th. Yeah, 18th.
February 18th. But again, you can go on the other meetings if you'd like, but we don't have to be on until the 18th. And hopefully before that, we'll have a septic plan submitted to review prior to, and comments from the review engineer. Is that the meeting that we would approve the septic on that 18th meeting? Do you have the agenda in front of you, Chris?
I don't have the agenda, but I think I think we'll close and vote on everything at the end, the last meeting. So it's not that meeting.
Okay.
Yeah, because how can we vote on something if we don't even have a submitted plan?
Right. Well, and it'll be our chance to discuss any comments we have during that meeting. And then if there's any changes, they'll make the changes before the last meeting where we'll vote.
Okay. So February 18th will be our review of the plan, that we should have the plan by then. And then for the final meeting, then we'll vote to approve it.
We should have it before that meeting so we can have any comments and discussion in front of
Okay.
in front of them.
All right. Thank you for that update, Chris. Next on the agenda is review and approve meeting minutes as typed for November 4th, 2020. All three members were present at that meeting. I have no comments on it. I read it and don't see any names.
Yeah, I'm okay with it.
Chris?
Yeah, I'm good. Make a motion. We approve the Board of Health meeting minutes dated November 4th, 2020 as typed.
Second that.
Any discussion? All in favor? Bob Palucci?
Aye.
Chris Pratt?
Aye.
Derek Maxim? Aye. All right, thank you. That is it under that. I'll turn it over to Ed if he has any recent Board of Health agent pending items you'd like to discuss or bring up to the board. And if not, you can just maybe do a COVID-19 update where we stand with that for anyone watching.
Yeah, no recent pending items, but for the COVID update, we're still getting a lot of cases in Lakeville, probably about 60 a week. That's confirmed. I'm sure we're getting more than that. But it does kind of appear that we're leveling off. We're not actually getting worse anymore, which is a good sign. So I think the holiday surge is over, and hopefully they're leveling off. And hopefully over the next couple of weeks, we'll kind of decrease those numbers. The other big news is the vaccines. they're finishing up with first responder vaccines. And then tomorrow they're going to start with home health aides vaccinations and healthcare workers that are not COVID facing. So they will be eligible for vaccines in the week coming up. We get a lot of questions from the public, and we're finishing up on phase 1. That's the healthcare workers and home health aides. Phase 2 will probably start in the middle of February, and that's when the general public, not everyone, but for people over 75 and people with 2 comorbidities, that's when they will be getting it, probably around the end of middle to end of February. Now they will come out with an ad campaign, the state, on both on radio and TV, announcing that, you know, when those people will be eligible. So like I said, but right now, for the group 2 phase 2, there is no one is eligible right now. Like I said, we're still several weeks away from that. So that's it.
All right, thank you for that update, Ed.
And, so the phases, they're each like steps, kind of like the phases of the vaccine with steps in between. That's the way it's same as like the regular phases are. Is that how they're doing it?
Yeah, pretty much. Like I said, phase 2 will probably last, the phase itself will probably last for several months, but all pretty much February, March, and maybe even into April. But the first part of that phase will be the older over 75s. Then after that, you'll have like the teachers and then other workers. So it is going by steps. And like I said, the last step of phase 1 was the healthcare workers who are not COVID facing. So they don't see COVID patients every day, but they're still healthcare workers. So they're the ones who will be getting vaccinated over the next week or so.
Sooner the better for me.
Yeah, they are on the way,
Yeah.
you know, so like I said, if we can keep these numbers down over the next couple of weeks, then we can get those most vulnerable group vaccinated. And that's the key group that most people are really concerned with.
Yeah, I don't think I'm eligible to like step 3 of phase 2.
I went
Yeah.
down the checklist. I have 5 of them, so I'm gonna be after the old people. I think I'm right there.
Yeah, that's a
So-
good point. For those people who do have comorbidities, you know, you should definitely check with your doctor, like to make sure you have the ones on the list, because you want to be in that first group. If you think you have comorbidities, you don't want to wait just for the over 65s, because the 65 to 74, they will probably come in March. So that'll be another whole month that those people will have to wait if you're under 75 and have comorbidities. So make sure that you get to your doctor and you know, he allows you to get the vaccine, or he clarifies that you do have those comorbidities, because those are really essential, and that's a big group. And so we do want to get that group, but we want to make sure that they're all ready and everything to sign up in February. So talk to your doctor beforehand.
Yeah, just from experience, I know it's still kind of confusing, because one of my specialists, after meeting with them, emailed my doctor because she can't, you know, they're not, your general, I guess, has to do it. And he sent an email back to both of us saying, you know, they have no information yet. They have no way to, you know, they didn't know if they're supposed to write you a prescription so you could go to a Walgreens and get it. I mean, I guess I'm sure that'll all get cleared up in the next couple of weeks, but I mean, up to date, it's been easy. You get your badge. If you're a cop, or a firefighter, you can go in and get your shot. You know, they show up at a nursing home, anybody in the nursing home, but I guess now they got to really work out the system to know, like you just said, how do you know if you have, you know, if people have 2 or more, or how, you know, so I don't think it's all that part of it squared away yet, but I mean, I'm sure in the next month that'll become a priority to, you know, figure that out one way or the other.
Yeah, you're right. There's not a system yet. And like the other thing is too, not all doctors will be giving the vaccine, be providing vaccinations. Some primary care clinics will do it, others will not. Some pharmacies will do it, others will not. So it's really going to be like, until we get all the details worked out, there's still going to be a lot of confusion. They have set up Gillette Stadium for that. So Like I said, they're not doing phase 2 right now. They're still doing phase 1. But when we get into phase 2, you will be able to go there. But like Bob says, you're going to have some evidence of that you have comorbidities.
Yeah, and Gillette's up and running. A friend of mine got vaccinated there yesterday. So, and Fenway should be opening up this week, I believe, too. So,
And there'll be more in the coming weeks.
Yeah.
Okay, thank you for that update. Bob, any other comments on pending items or anything?
No, I'm good. It's just, I'm glad to hear that we're leveling off. I mean, we're leveling off at a very high number, so, hopefully at some point, I'm not a doctor, but at some point now, the older people are gonna be getting their shots. So many people have had it already, that gotta be helping a little bit, you would think, so. So let's just hope by the springtime, we can have some resemblance of life going back to order. So I'm trying to be optimistic. Ed, if you know that's not going to happen, don't tell me. Wait till I sign off. So
No, I'm being optimistic too, Bob. And I think once we get the older group over 75s vaccinated in February, I think you're going to see a big drop in the deaths. You'll still have cases because people will still be going out and stuff like that. But the main thing we're concerned with here is the deaths, and that's what we want to drop the most. So, like I said, the cases won't drop, and we'll still have to take precautions. But as long as those deaths go down, that's going to be a big relief for everyone.
All right, thank you. And Chris, any comments before we adjourn?
no, I'm good.
Would you like to make a motion?
Make a motion to adjourn.
second,
All in favor, Bob Palucci,
I.
Chris Spratt,
Aye.
Eric Maxim, aye. Thank you, everyone. Thank you, Ed.
Thanks, guys.